Hi there, it's New Zealand naturopath Eric Backer, author of Candida Crusher and formulator of the CanXida range of dietary supplements. Today we're going to talk about the causes of leaky gut syndrome. Leaky gut syndrome is a condition of the Western developed nation. It's not something that people really get in the underdeveloped countries. And I'll expand on that in a minute. That happens for a multitude of reasons. So leaky gut is altered intestinal permeability, and it usually means because the person has altered their lifestyle far away from nature. People who eat and live according to the natural laws, who eat fresh, wholesome foods, who drink lots of fresh water, who get plenty of sleep, these sorts of people don't tend to have leaky gut syndrome. The relaxed people who don't push themselves too hard. But we don't live like that in the Western world. We tend to be really time poor these days. And what I'm finding after being in practice now for nearly 30 years is that more and more I'm seeing people with chronic digestive problems. And I think that's because people now tend to stay up too late at night. They're not getting enough rest. They tend to be too dependent on these electronic toys and gadgets all around them. They tend to not chew food properly. They tend to drink alcohol and caffeine. And a lot of people now are bypassing really good quality foods, tending to really eat more of a processed kind of a food. These sorts of things in particular are pushing people into leaky gut syndrome. The primary causes, however, I would say the top 5 or top 10 would certainly be alcohol of any sort. So people who drink alcohol on a regular basis are invariably going to have leaky gut syndrome. I've got no doubt in my mind, and it's just one of my clinical observations now. If you don't drink any alcohol at all, you're much less inclined to have leaky gut. So it's not just the one thing that will push a person into leaky gut. It's a combination of multiple factors in their diet and lifestyle that will contribute to this functional complaint. Antibiotics, alcohol, stress, not chewing food properly, any kind of medication on a regular basis. It could be something like Advil or ibuprofen. It could be paracetamol or Tylenol. It could be an antidepressant, birth control pill. It could be a statin drug. It could be a blood pressure pill. Any kind of medication you're taking from the doctor, whether it's prescribed or OTC, over the counter. Even some dietary supplements from your naturopath can contribute to leaky gut syndrome. So some patients I see take up to 50, 60, or even 80 supplements in one day. It's crazy but true. So if you're one of these people who's buying, supplements from iHerb and from Amazon and all over the place, and you're going to see 2 chiropractors and 2 naturopaths and 2 doctors and 2 psychiatrists, and you're seeing all these people and everyone's giving you stuff, you're taking all that, and you're still not getting better, you've probably got leaky gut syndrome. So take heed. Don't take things unless you get an expert advice regarding that supplement. A really big underlooked cause, or overlooked cause I should say, is antibiotics in the food chain. So if you're eating meat or poultry, they could contain medications like a low dose antibiotic in that. And we know low dose long term is as bad as high dose short term. So you want to just check the kind of meat you're eating with your supplier if it's got any kind of antibiotic in it. And if you're unsure, just do some Google checks on it yourself. You might be quite surprised what you'll find. So certified biodynamic or free range, certified free from these sorts of drugs, chemicals, is certainly what you want to be looking at for food. That's why I prefer to eat ocean caught fish, because they don't usually inject fish with antibiotics. So chewing food. A lot of people don't chew food properly. They chew too quick. So they don't activate the parasympathetic nervous system. So chewing food really quick is a sympathetic response, a stress response. And this will mean that you're not going to break food down to small particle size. It'll also mean that if you have got leaky gut, which you probably have, you'll put larger particles there into the small bowel, which could potentially permeate and challenge your immune system. So chewing food down as far as you can, really breaking it down, will allow your organs, digestive organs, to make a just nice soupy sort of mix out of it. And that's going to be easy to break down and to absorb. So that's a big reason why many people end up developing leaky gut also, is improper chewing of foods or eating too hurried. Drinking alcohol with meals is insanity. That's going to certainly have a contributing factor with leaky gut. I don't care what people say. I've heard many so-called experts argue with me that alcohol is no contributing factor, but I've seen too many patients over the years to tell you that I don't really believe that to be true. If you truly want to heal the gut really well, you have to stop drinking all forms of alcohol for 3 to 6 months, preferably 12 months, until you can really recolonate that gut. As I've been told before, if you're not serious about your health, then go and take it somewhere else, you know. If you're serious, then you will do these things to rebuild your health. Because remember, it's a statistical fact that more people spend tons of money in the last couple of months trying to stay alive than they do in their whole life trying to keep well. So if you're really serious about your health, you'll be serious about eating the right kind of foods in the right kind of conditions. It's going to make a big difference. But it's your call. I mean, it's your life, it's your body. So those are some of the causes of leaky gut syndrome. No doubt there's a whole ton more, but look at the basic ones. Not eating properly, eating the wrong food, eating with stress, not resting up enough. It's no rocket science again. It's all pretty well commonsensical. Thanks for tuning into my video.